Hello everyone. Today's the topic is Angina Pectoris. It is one of the topic in medical surgical nursing. So in this video we see what is Angina Pectoris, what is the types of Angina Pectoris, what is the signs, symptoms, risk factor, pathophysiology, management and prevention. So first is what is the definition of Angina Pectoris. Angina Pectoris, it is correct medical condition characterized by chest pain. It is the common symptom that is seen, that is like chest pain, but here there is a squeezing, a severe chest pain. Medical condition characterized by chest pain, usually on the left side due to the inadequate blood supply to the heart muscles. So there is the inadequate supply of blood to the heart muscle. Why this insufficiency of the blood supply to the heart? There are three reasons. One is there is presence of blood clot, the narrowing of the valve, lumen diameter of the vessels, and the contraction of the coronary artery. These are the three reasons that why chest pain or the inadequate blood supply to the heart is occur. According to the three causes, these are classified into three types also. One is stable angina pectoris, another is unstable angina pectoris, and third one is vibrant angina pectoris. In stable angina pectoris, what's happened? The vessel's lumen diameter become narrow due to the deposition of some plaques. And in stable angina pectoris, the chest pain also relieved by taking rest also. In unstable angina pectoris, it is more severe than the stable one. Here, the narrowing of the vessels occur due to the spasm and also present of some blood clots. So, it is not relieved by taking rest. Then vibrant angina pectoris. In here, what happens? The vessels, the wall become constricted and it's called spasm of the blood vessels. So here the lumen diameter become very thin and narrow. So the supply of blood is decreases. So that leads to workload of the heart. Then what are the sign symptoms? Most common sign symptom is one is that is chest pain, such as tightening of the chest, discomfort in the jaw, neck and the arms. In here the left side is more left side you feel the chest pain is in left side is more than in compared to right side of the chest. And this chest pain also very severe and squeezing like sensation. It's radiate from the chest to the arms, jaw and hands also. Then what are the risk factor? What are the risk factor that increase the chances of angina pectoris? One is tobacco uses. Next one is patients having high blood pressures, increase in blood cholesterol levels, and a lack of exercise, obesity, and the stress. These are the risk factors that very prone to angina pectoris. Then what is pathophysiology? In this pathophysiology of angina pectoris, as you know, there are the three causes by which the insufficient blood supply to the heart muscle that leads to damage of the inner layer of the coronary artery, and the oxygen demand of the, as there is the lumen diameter become very narrow, so the oxygen demand of the organ increases. To resolve this oxygen demand, so work has to work hard, so that is workload of the heart is increases in, and the decrease in the oxygen level in the heart develop ischemia or that is the chest pain. Then in that case, patients with having the chest pain, first we have go for medical management. Okay. In medical management, we first provide them vasodilator. That vasodilator helps in dilate the lumen diameter of the vessels. Then second one is beta blocker that decrease the heart workload. Okay. Next, calcium channel blocker. It is improve the coronary blood flow. The smoothly blood is flow from the vessels. And anticoagulant. Anticoagulant, if there is presence of blood clots, that can be solved by the anticoagulant drugs. And analgesic. Analgesic, as you know, it is the relief of pain. And also antihypertensive drugs. Patients having previous history of blood pressure, they also the instruction by the doctor, the antipyretic drugs should be advised in that case. Then nursing management. In nursing management, but first one is to treat the chest pain. How we treat the chest pain? Instruct the patient to stop activity at a point when the patient is complaining of the chest pains. Instruct the patient to stop the activity and sit or lie on a comfortable position. The most comfortable position is semi-flower positions. And monitor the vitals every 5 minutes. Don't leave the patient alone. They monitor the blood pressure, heart rate, pulse rate every 5 minutes. And administer oxygen, nitrogen, nitrates in the analgesic age order. If the patient is unable to take oxygen or meet the oxygen saturation, we administer the oxygen by nasal tube method. Then observe the person. After this medical management, also by treating the chest pain, next we observe the patient's symptoms of dyspnea, nausea and vomiting. After these treatments, medications or giving rest, next we observe further any sign of chest pain is there, dyspnea, nausea and vomiting, because these are the vital sensations related to angina pectoris. Okay. Then elevate the head end of the patients. Where the patient is sleeping in hospital or in home, that case we have to elevate the head end of the patient's bed. It helps in to solve the shortness of breath. And also maintain a quiet, comfortable environment for the relief of stress. So patients should be provided, the surroundings should be not noisy and calm and quiet and free from any discomfort. Then instruct the patients about all the procedures and solve their question. Due to the patients having the chest pain the first time, lots of question arises inside his mind. So we have to solve their questions and answer their question, and also describe what the procedure were taken, like ECG and chest X-ray. In that case, we have to explain the patients to relieve the anxiety of the patients. Then last one is prevention. What is the preventive measure we should take to avoid this angina pectoris? One is quit smoking. Those who are taking smoking regularly, they immediately quit the smoking and limit alcohol consumptions. So alcohol consumption, they have to control their consumption of the alcohol. And monitor BP, diabetes, blood sugar level, blood cholesterol level. Those who are patients history of blood pressure and diabetes, they must consult to the physicians and monitor their blood pressure level, sugar level and cholesterol level regularly. And eating healthy diet, that diet that is rich in fiber and very light diet you should take, and that diet must not low in fat, cholesterol level, low cholesterol level and low in salt also. Okay. Then increase the physical activity. Advise the patient to take some break in his lifestyle and 5 to 10 minutes in the daytime or in the morning, in the evening, they should walk, jogging, light exercise they can do. That is very fruitful for the patient suffering from the angina pectoris. That's all on this my topic. Next class we will read other topic.